One of our roles is sharing insights from clinicians who specialise in chronic UTI. Ruth Kriz is a nurse practitioner and has been treating patients with chronic urinary issues for 35 years. When she herself was in her 30s, she was diagnosed with interstitial cystitis and has a story that many of us might relate to. Ruth says, like with most people, when you personally experience the problem, you have a whole new motivation to figure it out. I developed interstitial cystitis and my first urinary tract infection in my early 30s and went the traditional route with urine culturing and antibiotics and basically was failed by the medical profession. She explains that IC became a diagnosis of exclusion. They ruled out bladder cancer, an obstruction or some functional problem, and if you were culture negative, then you had this bizarre, unknown condition called interstitial cystitis. So the line became very fuzzy between chronic urinary tract infections and interstitial cystitis. In order to receive this diagnosis, an infection must be ruled out. The problem, however, is that the testing methods used to identify a UTI are inaccurate up to 50% of the time, meaning that those with a diagnosis of IC could actually have a missed infection. Ruth's own experience has led her to having greater empathy and motivation to help others struggling with bladder health. We have an article on interstitial cystitis treatment with Ruth Kriz on our website, and you can access it via the link in our bio.